So our poster presentation is on chapter 13 of the long textbook, Counseling Survivors of Sexual Abuse and Their Partners. And it really focuses on how this is present in our movie, which was Addicted. So I'm going to present my screen so we can see here. Um, Basically, our introduction rationale, our case study, we are able to analyze our client's issues in sexuality, beginning with the trauma of being sexually abused as a child and how this has affected her, her personal and professional life. A quick summary of the movie. Zoe Reynard is a successful businesswoman. She's married to her high school sweetheart, Jason. They have 2 kids. She fell into a sexual relationship at first with a well-known artist um, that she met through her career. And this started because she had a lack of intimacy in her marriage already. The artist had made relentless attempts to gain Zoe's attention. She began seeing a therapist where her therapist had diagnosed her as a sex addict. Several sessions with her counselor, she had asked her about her childhood, and that brought about a lot of feelings of denial and hostility and anger within Zoe, and she felt that it was not important in helping her with her current issue. Zoe would refuse to speak about her past experiences. She began a third sexual relationship with another man. And she went to end the relationship so that she could focus on making her marriage better. And basically, she was put in a very dangerous situation. Her husband actually ended up finding out where she was and about the affairs because she had left her cell phone at home, and he read through the text messages. And he came and saved her. But after saving her, he basically told her he did not want to continue the marriage. She stepped out in traffic to end her life. And although she recovered from the accident, her husband still was not really able to put the affairs past them and fix the family. So Zoe ended up becoming active in a Sex Addicts Anonymous group for recovery. And it was in her first session that she discloses that when she was a child, she was raped by 3 boys. So the synopsis of her problem: hypersexuality, potential PTSD due to her abuse as a child because she is a sexual abuse survivor. Hypersexuality has been rejected from the DSM-5. It is actually tends to be diagnosed as a sexual disorder not otherwise specified. And it is described as distress about a pattern of repeated sexual relationships involving lovers who are only things to be used. The ICD-11 has decided to include compulsive sexual behavior disorder in their newest version, which will come into effect in January 2022. The associated features with compulsive sexual behavior disorder are sexual urges that can't be controlled and lead to becoming the central focus of the individual's life. Creates a lot of chaos and distress in both the personal and professional life. Signs and symptoms of sexual abuse are most commonly desire disorders, arousal disorders, and orgasmic disorders. It is actually really difficult to find statistics that accurately represent hypersexuality because it's not always reported by those who experience it. This is a lot because they might be in denial or they might feel shame or embarrassment of being a sex addict. Therefore, the only statistics that we really know are based off of those who actively seek treatment. However, we can, from this information, determine that about 6 to 8% of Americans struggle with sexual addictions, which equates to about 18 to 24 million people. We also have, in conjunction with sexual addiction, the use of pornography and the prevalence of it in the world. There are 72 million internet users worldwide who visit pornographic websites every month, and 42 million pornographic websites exist making up about 12% of total internet websites. In the United States, there are 40 million adults who regularly visit pornographic websites, and out of these, 1 in every 3 are female. Statistics on rape include the year 2000, it was reported that 302,100 women are raped in the United States each year. The CDC reports that 42.2% of the first sexual experiences that are forced occurred during adolescence. And the prevalence of unwanted sexual experiences reports between 13.5% to 30%. So some of the methods and strategies we can use for Zoe in counseling are restructuring behaviors and restoring her personal power and control over her sexual expression. This can also be done through couples counseling to increase emotional contact with the partner, providing non-demanding sexual expressions such as holding hands, taking walks together. We can also teach self-regulation skills. There's 4 steps to self-regulation: experience, express, contain, and retrieve. And this basically is how to regulate your emotions and feelings. We can learn or teach and implement coping strategies, help Zoe create a list and examine the list of coping strategies, and really identify the positive assets that can assist her in coping. Addressing her guilt. It's very important to allow Zoe to express her feelings, to define what she felt she could have done differently. Survivors often need to address these several times before they're willing to identify that maybe the rape was not their fault. They also need to work on building trust back into their relationship and building that positive and supportive team to help Zoe overcome her addiction and her trauma, and as well as exploring intimacy with her husband. They need to write in journals, pay attention to each other's feelings, really listen without judging, using touch, not just with each other appropriately, but with others, their family, friends, outside of their marriage. There are several treatments that can be implemented with Zoe as well. Obviously, we think that there could be a presence of another medical condition or psychiatric disorder, such as PTSD, because they often coexist. So there could also be some support and recovery groups that are available for her. She is attending Sex Addicts Anonymous already. There's pharmacological care where she can use various pharmaceuticals to help address some of her behaviors along with treatment. And then we have cognitive behavioral theory, which is going to really be very helpful for her overcoming both her sexual abuse and her hypersexuality, because they are going to treat both behaviors and help her restore her mindset. So some different methods we could use are psychoeducational training to help her become more knowledgeable and open up dialogue with others about her addiction and her abuse. It also encourages abstinence in the initial phase so that she can start to identify sexual urges, control her impulses, and achieve an overall behavior change. There's a lot of role-playing technique and even exposure therapy that can help her cope through different situations, as well as journaling her feelings. We also have Gestalt techniques that can be implemented, such as the empty chair technique, to allow her to face that childhood trauma, whether it be facing herself as a young girl, her rape, the people who raped her, her perpetrators, or even her husband, on helping her decide how she wants to address things with him as well. Then we have some solution-focused techniques that we could use, such as using a miracle question, scaling to help her identify where she stands on her sexual addiction. That can be implemented with both her and her husband at the same time. There's other techniques such as eye movement desensitization and reprocessing, and basically that uses rapid eye movements to eliminate painful memories. We have movement expression, dance, theater, martial arts, and basically all of that creates a personal power through the physical movements and experiences and sensations. And then, since Zoe is in the art industry, art therapy might really be helpful in helping her express her feelings and emotions through drawing, painting, photography, and other forms of art as well. Multicultural competencies, basically, in a diagnosis, the client's age, ethnic, cultural, religious backgrounds should be considered as primary factors. Um, Unfortunately, with rape, most victims are young and female. Um, on top of that, most people experience their first sexual assault before the age of 18. African Americans have the highest prevalence of being forced into sexual intercourse. And the CDC says that the prevalence of rape is about 1 in 5 for African Americans and whites. African American makes 22%, white is 18.8%, and 1 in 7 for every Hispanic, which is basically 14.6%. Unfortunately, very few cases of rape are actually reported to law enforcement. Specific implications are that there are other disorders that could be present in sexual addictions. And in this case with Zoe, we do know that she did have a trauma as a child and sexual abuse, and there could be some PTSD that is involved with that. There are other issues that can be present as well in some clients, such as bipolar disorder, other mood and personality disorders. There's substance-induced sexual dysfunction, where the addiction is based on substances, and then other personality and relational problems, personality disorders and relational problems. However, counselors need to know it is imperative to treat all conditions associated in order to prevent a relapse. In conclusion, a thorough assessment is absolutely vital in helping to determine the basis for their addictions, underlying issues, and disorders. And it is important to address those underlying issues and disorders. The counselor needs to always remind the client it's a lifelong journey to recovery, and there are going to be days that are harder than others. And it is important to always focus on the goals and take things one step at a time. And lastly, incorporate family and friends in the recovery process, because everyone is affected, and it is important to build a positive team for the client in helping them persevere and recover from their addictions.